Chemistry for Biology channel. I'm John Irwin. Our topic today is From Diagnosis to Prescription via Targets. You can find more of these kinds of videos on our website or at on our YouTube channel, which you may have already found. So, you're working on a new disease, or you've been working on it for a long time, and what do you want to know? Well, one of the things you want to know is, what are the targets that are thought to be important for treating that disease, and what is the clinical status of each of those targets? And to do that, you want to consult the literature. So the sorts of things you want to know is, what are the existing therapies, and what is their mechanism of action, and what is the most advanced clinical status? For instance, is it in animals? Is it in people? Is it in man? Is it approved by some agency like the FDA? And the other thing you want to know is that for each of those targets, you want to know, well, you might like to be able to purchase compounds for each of those targets. And when we tried to do this for our own work, we found that this was surprisingly difficult to do. And therefore, we created a tool that makes it easier to do. And I want to tell you about that. So let me explain a little bit about the background first. So the context of how we did this. We used the zinc database, which I've got here in red, 21 million purchasable compounds, which we update all the time from vendor catalogs. And then we've also used the Chembl database, and we're currently updating to Chembl 14, so as I speak. And so there are about, depending on how you count targets, about 2,600 targets in Chembl, and about 250,000 data points that link targets to compounds. And now for each of those targets, there are about 11,000 diseases in the dictionary called the ICD-10. This is the WHO-sanctioned, internationally widely used database of indications. And of those indications, we managed to link about 2,500 from diagnoses to target indications links. We use the TTD, we use Drug Bank, we use a number of other public sources, and we also just use our brains, and we use our colleagues. And then 11,000 diagnoses is a large number of diagnoses, and so we've grouped them into about 50 disease areas, which are sort of organized around the same way that the pharmaceutical companies organize their research, or that that are thematically organized, and you'll see that soon. And so we call this, since it links diagnoses to prescription via targets, we call it DxTRx, and T-Rex means that we've got a dinosaur as our logo. All right, so that's the background structure. Let's go and look at what the database actually looks like. So if you go into DxTRx, what you find is at the highest level, we've organized it along disease focus areas that I mentioned on the previous page. And so here, for example, are the cardiovascular area, respiratory area. This is a cut because it's a long page. Tropical diseases, virology, adverse drug reactions. It's not usually how you organize research, but it made sense to organize things that way. And so for each of these, there are a certain number of indications and correspondingly a certain number of substances. So if you were to click on Tropical Diseases link, it would take you to a page that looks like this. Let me talk you through this. So each item in DxTRx can be curated by an expert. And so in this case, there are two different curators who have signed up, who have volunteered to help curate this page, and they log in and they can update this information, because there's no way we could possibly do it ourselves. And so if you're an expert in tropical diseases, you can volunteer to help and click on that button. But for now, what we will do is look at the diseases. So inside tropical diseases, we've organized it just as you'd expect: Chagas, dengue, parasitic worms, leishmania, and so on. The list goes on and on. I've just chopped it off here. And so if you were to click on Chagas disease, for instance, again, curators associated with this page are here at the top. If you're an expert in Chagas disease, you can volunteer to help us. And inside the Chagas disease, then there are individual, now we're down at the ICD-10 level, so this 57.0, B57.0, is the code for acute Chagas disease with heart involvement. There are other variants like without heart involvement or the chronic version of the disease. And for each indication, summarized here are the number of substances that are annotated in the Chembl or in other databases, the number of these that are purchasable according to zinc, the number that are natural, that is to say, that are biogenic, so they're natural products, metabolites, and so on, and the number that are in man. We've also listed the number of targets associated with that disease, and the number of foci. Well, that's obviously wrong right now, so that's a number that needs to be updated. And sometimes there'll be a comment if necessary. At the right-hand side, you'll notice there's a question mark, and we'll come back to this later, but that allows us to allow users to annotate, to tell us if something is wrong. So for instance, if they wanted to, if they said, well, this indication, although it's technically called Chagas disease, doesn't really belong here, let's say, then this clicking on this button here would allow people from the general public to tell us that information in a highly structured fashion. Correspondingly, if there's something missing from here, then that could be also added. But for now, I'm going to click on B57.0, which takes us into the indication detail page. And so on B57.0, we're now in acute Chagas disease with heart involvement, and you can see that there are again, curators associated with this page, and now a compound summary saying that for 10 targets, total of 514 substances, and these are the same numbers we saw on the previous page, of which 73 are purchasable, 16 are natural, and 14 are in man. Disease foci, so Chagas disease is a member of both Chagas disease and also infectious disease. These numbers have not been updated and will be updated shortly. And then targets, of which there are 10, and obviously I've cut it off here, but you can see that the first target is CYP51, sterol 14 alpha demethylase for tryptanosomal cruzi, T cruzi. And so there is a PMID linking this, that explains the linkage between this target and this indication, and also the fact it will justify why it's a clinical target and not, for example, an approved target. And so now, again, we've got the question mark, which allows users of the general public, that is to say not curators, just general users, to submit suggestions on how to improve this page. And clicking on the target detail page, the target name takes us to a target detail page here. Again, there's a space for curators at the top, so these are the people who are responsible. It should say, would you like to volunteer? So that seems to be missing in this version of the slides. A compound summary of compounds that are active against this target. And remember that those numbers in the 500s that we saw on the previous page must have been included several other targets, because here there are only 2. And then indications. So there's clinical indications. So this points us back to Chagas disease, and that's why we got the 514, because those numbers come from other targets. Okay. If something is missing, for example, if there's an indication that's missing, you can make a suggestion. This is for general users. And as always, there's the question mark that allows you to update the page. And so if you click on, going back here, if you were to click on the 73, the number of purchasable compounds, you go to a page that looks very much like a normal zinc search result, in which you can see the pictures of the molecules, and if you hover the molecule over the molecule, you can see purchasing information. So you're really going in one page, you're going from indication via target to compounds that are active against the target that is thought to be the critical target for, or one of the critical targets for treating that disease. And if you go into the detail page for any one molecule, in addition to things that you're used to seeing, for like fluconazole at the top, you can also see Chembl annotations down the bottom, and you can see that it's annotated for, in this case, Mycobacterial tuberculosis, Aspergillus, and so on. Okay. So this looks like a duplicate of a previous page, and oh, this is to tell me that if you click on the question mark, that it'll take you to a page that looks like this. So the headline is Contact the Curator about the indication, Acute Chagas Disease with Heart Involvement. Are you making a new indication target or indication focus association, modifying one, or are you making a general comment? So you can tell us about a target association with the indication. You can tell us, in the case of about a focus indication, or you can make a general comment. And it's really helpful to put information in here, including PMID values, URLs, anything we can use to corroborate what you're telling us. Okay? And so then when you're finished filling in the form, you make the suggestion. And this is open to any registered user on docking.org who has access to this beta version of the software. And so what happens when you click on Make a Suggestion? Well, the curators of that page, which are at the moment me and my colleagues, receive an email message telling us that someone has made a suggestion. And they've said, someone has said that they recommend that the indication B57 acute Chagas disease association with the target CYP51 should be actually classified as experimental, and it was clinical. And so in the justification phase field, the person told us, look, this compound has not yet entered phase 2A trials, and thus it should properly be classified as an experimental target indication association. This is actually bogus. Okay, I did this for the purpose of illustrating how this works, but it allows me to say, look, approve the suggestion as the user provided it, or I can approve it but change the status, for example, to clinical, experimental, theoretical, palliative, deprecated, unknown, disputed, uncurated, and so on. Or I can, if I'm a curator, I can simply ignore it. It's not very nice, but you can ignore it. And we're working on mechanisms to send this back. It should really CC the original suggestor so that the message gets replied to. And so if you are a curator, you get to see this curator's form at the bottom of the page, which allows you on an item-by-item basis to edit the clinical status of each target indication association, as you can see here. So you can delete them, you can add new ones, you can modify the information, and so on. Here's how you add them here, and then when you're finished making the change, you say save. So this has been a Chemistry for Biology presentation, and our topic today was From Diagnosis to Prescription via Targets, the DxTRx system. This is a new system. In order to use it, you must be registered on docking.org, and you must request beta user status. So if you're not a beta user, you simply won't see it because we haven't published this work yet. All right. Thank you very much. Talk to you next time.